Uramaxin GT gel with prefilled applicator contains urea, which is used to treat dry and rough skin conditions such as eczema, psoriasis, corns, calluses, and some nail problems like ingrown nails. It can also help remove dead tissue in wounds to aid in wound healing. Urea is known as a keratolytic, meaning it increases moisture in the skin by softening and dissolving the substance that holds the top layer of skin cells together. This helps the dead skin cells to fall off and allows the skin to retain more water. It is best to follow the instructions provided by your healthcare professional for the appropriate dosage and the optimal timing for application. Make sure to use Uramaxin GT gel with prefilled applicator as directed by your doctor or as indicated on the product package. Some products may need to be shaken well before use, so be sure to check the label. Apply the gel to the affected areas of the skin or nails as directed by your doctor, usually 1 to 3 times a day. Rub it in well until it is absorbed, and remember to wash your hands after applying unless you are treating the hands. The frequency of application will depend on the product and your skin condition. Only apply the gel to the skin or nails, and avoid sensitive areas such as eyes, lips, inside your mouth or nose, and the vaginal or groin area, unless directed by your doctor. Be sure to ask your doctor or check the label for any specific directions about areas or types of skin where you should not apply the product. You should also consult your doctor or pharmacist for more details on whether you should cover the treated area with a bandage or gauze. It's important to use this medication regularly to get the most benefit from it. If your condition persists or worsens, be sure to inform your doctor. If you experience burning, itching, stinging, redness, or irritation, it is important to inform your doctor or pharmacist. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefit to you outweighs the risk of side effects. Many individuals who use this medication do not experience serious side effects. Be sure to contact your doctor immediately if you experience any serious side effects, such as unusual changes in the skin or signs of skin infection. While it is rare, a very serious allergic reaction to this drug can occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. Remember, in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Uramaxin GT gel with prefilled applicator, make sure to inform your doctor or pharmacist if you have any allergies or if you have a history of skin cuts, infections, or sores. Some ingredients in the product may cause allergic reactions or other issues, so it's essential to talk to your pharmacist for more details. It's important to be cautious in the sun while using this medication, as some products may make you more sensitive to sunlight. Be sure to check the label for any warnings or ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor or pharmacist may advise you to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, be sure to inform your doctor right away. Additionally, some products may stain or discolor clothing, so it's best to ask your doctor or pharmacist for more information on this. If you are pregnant, Uramaxin GT gel with prefilled applicator should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding and applying this product to the breast area, consult your doctor before continuing to breastfeed, as it is unknown if the drug passes into breast milk. It's important to note that Uramaxin GT gel with prefilled applicator may interact with other medications, which could affect how they work or increase the risk of serious side effects. To ensure your safety, it's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help to ensure that Uramaxin GT gel with prefilled applicator works effectively and safely for you. Always consult with your healthcare provider before making any changes to your medication regimen. If this medication is swallowed, it can be harmful. If an overdose occurs and serious symptoms like passing out or trouble breathing are present, dial 911 immediately. Otherwise, contact a poison control center right away. In the U.S., individuals can reach their local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. Do not give this medication to anyone else. This medication is prescribed specifically for your current condition. Do not use it for a different condition unless instructed by your doctor. In that case, a different medication may be needed. If you forget to take a dose, it's okay to use it as soon as you remember. But if it's almost time for your next dose, just skip the one you missed and use the next dose at your regular time. Don't try to make up for the missed dose by using more of the gel or using it more frequently. Stick to the recommended dosage and frequency. It's important to store Uramaxin GT gel with prefilled applicator at room temperature and avoid freezing it. Keep the foam product away from heat and open flame, as the contents are under pressure. Make sure to store it in a safe place where children and pets cannot access it. When you no longer need the product or it expires, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.